Have you ever read through a client's chart and felt like you were interpreting a different language? Hi, my name is Samantha. I'm a nurse here at UWorld. Nursing terms and abbreviations can get overwhelming since so many are used daily. Abbreviations in nursing are found everywhere: charts, orders, reports, and notes. Let's break them down together. Common medication administration abbreviations include things like PO, meaning by mouth. This is a medication that's intended for the oral route. PRN means as needed. It's common for pain meds to be prescribed PRN as they may not be scheduled at specific times and given only as needed. A lowercase q is used to depict frequency. For example, a medication may be due Q4 hours, meaning every 4 hours. BID, TID, and QID in all caps represent how many times a day to give a medication. Respectively, these stand for twice, 3 times, or 4 times daily. Many abbreviations that you hear on the unit refer to certain brands or types of equipment. A couple of terms you'll want to know include Foley, which is a type of indwelling urinary catheter. Dynamap is a common brand of vitals machine, and an Alaris or Baxter pump are both popular brands of IV pumps. If you've ever been in clinical, I'm sure you've been asked by a nurse to go silence that pump. Common abbreviations that you may see in documentation and charting revolve around the client's plan of care. DX represents diagnosis, TX stands for treatment, HX means medical history, RX is commonly used for prescriptions, and PX is used for prognosis. Understanding these abbreviations will help you better understand doctor's notes. Labs and procedures may also be denoted using abbreviations. CBC stands for complete blood count, which includes things like platelet count and white blood cells. A BMP is different from a CMP. A BMP is simpler, a basic metabolic panel, only including things like glucose, electrolytes, and BUN or blood urea nitrogen, among other things. A CMP is more extensive, covering all the components of the BMP, plus a few other measures such as total protein and AST and ALT. Certain abbreviations are banned as they can cause dangerous misinterpretations. This includes a capital U for unit or capital QD for daily. Always check your facility's approved abbreviation list to maintain protocol. Thank you for joining, and I hope to see you all soon. Have you ever felt lost trying to decode nursing jargon? Hi, my name is Samantha, and I'm a nurse here at UWorld. Nursing terms and abbreviations can get overwhelming since there's so many used so frequently. Abbreviations in nursing care are found everywhere: charts, orders, reports, and notes. There are so many to mention that we had to split this video into multiple parts. So let's break them down together. Common medication administration abbreviations include things like NPO, meaning nothing by mouth. This is reserved for clients who are ordered not to eat or drink anything, like a client about to go into surgery, or maybe a client on gastric rest. IVP stands for intravenous push, which is a rapid injection of medication into a vein using IV access. IVPB is an intravenous piggyback infusion or a secondary IV infusion. This is a slower route of administration than the IV push. Regarding injections, IM means intramuscular or an injection into the muscle. ID stands for intradermal. This route is used for things like the tuberculin skin test that tests for tuberculosis. SQ or SC represents subcutaneous or an injection into the fatty or subcutaneous tissue. This requires a smaller needle than an IM shot. Now, a miscellaneous abbreviation that confused me as a new nurse was BRP, meaning bathroom privileges. This signifies if the client can safely use the restroom independently. As a new nurse, I just thought this looked like the word burp. Now, many abbreviations that you hear on the unit refer to certain brands or types of equipment. A Chucks pad, for instance, is a disposable and absorbent underpad used in many different clinical settings. A wound vac is a negative pressure machine used to promote healing of a wound or incision. A JP drain is a Jackson Pratt drain, which uses gravity to remove drainage from a surgical incision. Now, certain diagnostic procedures will also be abbreviated, including CXR for chest X-ray, ABG for arterial blood gases, and EKG or ECG are used interchangeably to represent an electrocardiogram, which is a test that measures electrical activity in the heart. However, certain abbreviations are actually banned as they can cause dangerous misinterpretations. So things like QD, QOD, capital U for units, or trailing zeros like 1.0 are on the do not use list from the Joint Commission because they can cause dangerous medication errors. Always check your facility's approved abbreviation list to maintain protocol. Thank you all so much for joining today, and I hope to see you at a live stream soon.